Good evening, everyone. My name is Dr. Okafor Chidumeje, the Chief Executive Officer of OurDrKing Foundation. There is this practice I have started, and I want to suggest it to every clinician in Nigeria. I have discovered that most patients that come for secondary surgery, most patients that come for the second or third surgery, apart from the primary, the first surgery, especially cesarean section, they end up, of course, they can't actually tell what happened in the previous surgeries. So you end up going in blindly without knowing what to see. Now, if the person has, if there has been a salpingectomy or oophorectomy in the first surgery, you would know that it has happened. And if you now go in and you meet one ovary or one fallopian tube, and you come out telling the patient that that's what you met, most of the patients will start doubting it, and they will think maybe you are the one that actually did you are the one that did the incision, or you are the one that cut off the ovary or fallopian tube. But that's because the previous surgeon didn't give the patient a written note, not necessarily, or more like a medical report. So, and most hospitals don't like giving medical reports except on request, even after surgery. They only leave it for they only give referral notes, or leave it until patient requests. So what I've started doing is, immediately after surgery, I photocopy the procedure. I photocopy the post-op notes with the name of the surgeon, the assistant, the anesthetics given, the findings, and the OP note, that the operation notes. I photocopy it, I type it, photocopy it, and give the patient. Now, this becomes the patient's property. It's not a medical report, it's just the patient's property, so that in the next surgery, the patient will have to undergo, if it's necessary. The patient can just tender that note to the surgeon, even if it is 10 years later, that this is what happened in the previous surgery. I believe if you start this practice, it will go a long way to prevent unnecessary medical legal issues, and also make it easier for the subsequent surgeon to know what to meet when he goes in to the patient. This is a humble advice, and